I'm Dr. Neil Barg. I'm the county health officer and also a clinical professor of medicine at University of Washington. We're going to talk about the COVID vaccine this morning. What's it all about? So in this talk, I have a couple goals. The first, what are the facts? Then how does the vaccine work? How is the vaccine evaluated? And what are the side effects, plus what are the benefits? Over on the slide here, you see a picture of the coronavirus. The red structures there are the spike protein, and we're going to talk more about the spike protein. What are the facts? Nationwide, 55% of people are vaccinated about this time. That means they've had the second dose of either the Pfizer or the Moderna vaccine and at least one dose of the J&J vaccine. Unfortunately, that's not a large enough population to be vaccinated. 40 other industrialized countries actually have higher rates than we do. Let's talk about each vaccine. The Pfizer was the first one to be employed. The patients above the age of 15, the vaccine is fully approved by the FDA. From age 12 to 15, it's under study in a program called Expanded Use Access. And the persons between age 5 and 12, it's being evaluated, and it hasn't been submitted for EUA. After the EUA, it'll get submitted to the FDA. For people that are older than 65 or have underlying diseases that might impair their immune system, it's been recommended that a third dose is a good idea. Once you're fully vaccinated, the vaccine will prevent hospitalization and death in 88% of the recipients. There's a question.
So what are breakthrough cases?
So if you're vaccinated, it prevents disease in a lot of people, but not everyone. Some patients will get infected, but the important thing is the breakthrough cases are much less serious. Few of those patients have to go in the hospital, and even fewer will actually suffer severe complications such as death. So overall, the effect of the vaccine is substantial. The next vaccine available is the Moderna. It's about to be approved by the FDA. At the current time, it's still in the EUA, but easy enough to get. The schedule here is 2 doses, 4 weeks apart, where the Pfizer was 2 doses, 2 weeks apart. Again, the third dose has the same criteria as the Pfizer once the Moderna is approved. For this vaccine, it prevents hospitalization and severe disease in 93% of the recipients, a little bit better than the Pfizer vaccine. The third vaccine is the J&J, which stands for Johnson & Johnson. A single dose was originally recommended, but there may be more information supplied to the FDA and the CDC where a second dose may work better than a single dose. For 18 and older, this vaccine is still under an expanded use access program. This vaccine prevents hospitalization and severe illness in 71% of the recipients. Not quite as good as the other two. This is a diagram that shows what happens after you're vaccinated. Once the injection goes into your body, what happens, the vaccine particle is taken up by the human cell, which you can see here in the middle of the diagram. The vaccine consists of a molecule of mRNA surrounded by a lipid coating. That lipid coating is basically the same as the cell membrane. After the particle is taken into the cell, it opens up and releases the messenger RNA into the cytoplasm of the cell. That's the part where there's no DNA. The mRNA is taken up by the apparatus that manufactures protein, which is again in the cytoplasm. The spike protein is the result of the cell using the mRNA pattern to make the protein, which then is transported to the surface of the cell. Once the protein is on the surface of the cell, as you can see on the right-hand side of the diagram, it's available to be processed by the immune system. Once it's processed, antibodies are directed against the protein. And if you're infected with the virus later on, the antibodies bind the virus and inactivate it. Thus, that's how you become protected. And we'll talk about this a little more. There's a question.
So just to clarify, the vaccine does not alter one's DNA.
That's correct. The mRNA molecule, after it makes its protein, is degraded and basically can't go anywhere because it doesn't exist anymore. At no point during this process does the mRNA enter the part of the cell that contains the DNA. All right, we'll move on to the next slide. This is a little text again to review what happens. The Pfizer and the Moderna are mRNA vaccines. The mRNA, as we stated, codes for the manufacture of the coronavirus spike protein. Once the vaccine is injected, the cells near that will take up the protein, and then within the cytoplasm of the cell, the spike protein is constructed and then will go out to the surface of the cell. There is no virus that's made by this because other genes that would assemble the entire virus aren't there. It's just the spike protein. Once the spike protein is on the surface of the cell, the immune system detects it and makes antibodies directed against that very protein. As we stated, the antibody will then bind to the incoming virus, and the virus is coated with the patient's human antibodies, and then the immune system attaches to the virus and destroys it. The mRNA that was delivered into the cell is degraded very rapidly after the spike protein is constructed. Also, the immune system can remember the response, and there's special T cells that will be activated if the virus comes into the body later on. And once again, no live virus is produced by the vaccine. The J&J, or the third vaccine, is a little different. It's made from an attenuated strain, which means a weakened strain of another cold virus called adenovirus. The genes that would make the adenovirus able to infect are replaced by the genes that code for the protein that we've called a spike protein. The spike protein, similar to the other vaccines, then triggers the immune system to make the antibodies, and from then on, it works like the other vaccines. The antibodies are there, made by the human system, and can attach to the coronavirus if one gets infected and inactivate it. This vaccine, like the others, does not get anywhere near the part of the cell where the patient's own DNA is. And these are degraded just like the mRNA. Let's talk a little bit about mRNA vaccines. There's been a lot of press saying that it was brought to production too fast and it was brand new technology. And that's actually not the case. The technology has been around for decades and has been used to construct other vaccines for influenza, Zika virus, rabies virus, and cytomegalovirus. But those vaccines never made it out of the development stage, probably because they didn't work as good as the coronavirus vaccines. The COVID vaccine is made in the same way, using the same technology for those earlier vaccines. When they did initial tests on the COVID vaccine, it worked really well. And then because it worked well in those initial tests, trials were started to see if it worked for humans and protected against the virus. It also allowed them to check for side effects. Once these preliminary studies were done, there was larger studies conducted, and then the vaccines were brought into use. At this point, this mRNA vaccine has made it through the evaluation period. And other examples of the use of mRNA have been used to treat cancer cells, which direct the immune system to attack the cancer cells. Once the studies were done, the preliminary data looked good enough to move forward with large clinical trials. The FDA reviewed the vaccine preparation and manufacture, and those factories that were making it met all the quality and safety standards. Thousands of patients were then enrolled in initial trials to determine how safe they were and how well they worked. Additional studies were done on even more patients, and the evaluation was continued with FDA oversight. Each of the phases of study were randomized double-blinded, which means people got the vaccine and other people got just placebo, which means there's no effect of it. And the occurrence of disease in both of these types of patients was compared. All of the data from all of the studies were submitted to the CDC and the FDA. All facilities making the virus were inspected closely. And all of the information that was submitted to the FDA and CDC were also submitted to an independent panel of experts for additional review. That panel was called the Vaccine and Related Biologic Products Advisory Committee. The panel recommended each of the vaccines for an expanded use access. The FDA commissioner also reviewed all the data and the process and signed off on it as good. The CDC Advisory Committee, once the approval for the vaccine was present, asked the following questions: who should be vaccinated? How many doses should be administered? How much time should elapse before the second dose? And all those recommendations were approved by the CDC director. So the Moderna said the first dose was administered, and then after that, 4 to 6 weeks would elapse before the second dose. The Pfizer, the second dose was determined to be best 3 to 6 weeks after the first dose. So after all this study and intensive review, the vaccines were determined to be safe to use. The EUA was issued for Pfizer in December 2020 and has been used since. The Pfizer is now FDA approved. The EUA was issued for Moderna in February 2021, and all the data has been submitted to be approved. An EUA was issued for the J&J also in February 2021. The EUA for the 12 to 15-year-olds has been recently issued and is undergoing study. And there's an additional EUA out now for 5 to 11-year-olds. There is an EUA for the third dose, also referred as the booster dose, for the summer of 2021 for persons with immunocompromise. There's another question.
Why is an additional dose of the Pfizer vaccine for certain people recommended?
So for 65-year-old and older, the immune system may have weakened enough to require another boost to have it bring up to the levels it was shortly after the original schedule. And people who have underlying diseases that weaken the immune system, a third dose has also been shown to boost their immune system response. And both of those folks are thought to be boosted enough that the vaccine protection is the same as immune compromised folks. This is a summary of all of the phases of study that are completed before the vaccines are used in a EUA, and then even additional evaluation before it's approved by the FDA. The point of this slide is to show you how much oversight there is on the use of these vaccines. Another question?
Yes. What are the ongoing studies that are occurring right now?
So the actual studies that are going on involve the third dose, but data is being reviewed regarding the approval for Moderna and the approval for the J&J. Also in the pipeline, there are some other vaccines that will be studied in large scale in the future. So let's talk about the side effects. We've mentioned how well it works, but what are the downsides? Well, These have been collected because this is a very closely monitored vaccine. The majority of the side effects are quite minor and occur within 2 to 3 days after the vaccine is administered. And very rarely, there's severe allergic reactions. The most common reactions are pain, redness, and swelling at the injection site. And other people may find fatigue, headaches, muscle and joint pains associated with chills and fever. All of these resolve after a short period of time. Another question?
We know that for some individuals who got COVID, they are now experiencing long COVID symptoms. Once they get vaccinated, is there any change to this?
Yes, there have been reports of patients having decreased symptoms or elimination of the symptoms once they are vaccinated. And again, vaccines are recommended 3 months or longer after the patient's originally infected. So there are some safety concerns regarding the serious reactions. And this table here shows the list of safety concerns, and they're rare. For instance, the J&J, they've observed clots occurring or a disorder of the platelets that are called TTP. And this occurs in 7 patients out of 1 million, quite rare. Another process called Guillain-Barré may be triggered by the immune system related to the vaccine, but it's not caused by the vaccine itself. The rates of this nerve disease are similar to other vaccines. For the Pfizer and Moderna, there's been studies regarding myocarditis and pericarditis. This is inflammation of the heart muscle or inflammation of the membrane that surrounds the heart. This occurs most oftenly in teens and young adults and occurs within 5 days of the vaccine being administered. Most of the patients that have this do recover and have no long-term problems. The incidence of this process is about 12.6 cases per 1 million. Now, keep in mind, many millions of doses of the vaccine have been given, so we should expect to see some of these problems crop up. Anaphylaxis, which is a very serious allergic reaction, causes problems in about 4 cases out of 1 million. Again, a very low percentage. So we talked about the downside of the vaccine. What are the benefits? So if you're unvaccinated, you have a risk of getting infected that's 4.5 times higher than if you're vaccinated. If you're unvaccinated, you're 10 times more likely to be hospitalized compared to people that are vaccinated. And if you're unvaccinated, there's 11 times more likely to die than vaccinated people. Only 1 in 500 infected patients have died from COVID, but when you figure there's almost 700,000 cases in the United States, that is a lot of deaths, many of them preventable if people get vaccinated. This is the last slide of the talk, and it just shows what's happened to the incidence of COVID in the United States. It started out slow in April of 2020, then peaked in the winter of 2020 and 2021, and then dropped off. The vaccine started to be employed in about this area. There was another bump here, and then it dropped down to very low levels in July 2021, and then blew up again. Now, this outbreak here was due to alpha virus, and this outbreak here was due to Delta virus. And Delta virus was found to spread much easier than the alpha virus. But more and more people have gotten vaccinated, more and more people have gotten infected, and finally, we think there's a drop. Recent data shows both decreased cases and decreased incidence of death. So that's the review of vaccines with the current technology and at the current time. Thanks for listening.